forget that. All right, we're going to go ahead and get started because we have a lot of stuff to cover today in just an hour, and I'm so glad you're here with us. We have a lot of people joining us from all over Florida, so as they kind of trickle in and things like that, we'll go ahead and get started, but this is being recorded, and so everybody that registered will also get the recording as well as a PDF of the slides. If you need a participation certificate, you can just email me afterwards, and I'd be glad to send you a participation certificate. So we can do that. And so just a couple other housekeeping before we get started. In the chat box, I would love to know where you're from in Florida and the temperature and the organization you represent. Stephanie and I are located in Iowa, and so it's like 50 degrees and it's been unseasonably cooler than normal. And so whenever I do my Florida webinars, I'm just so jealous and love to know what the temperature is and the weather and things like that. So again, this will be recorded. We have a lot to cover in an hour. Feel free to ask questions as we go. I will try to answer them as much as possible. My colleague Stephanie is on with me today, and she will be monitoring the chat and the Q&A. So she'll either stop me in the middle, or we'll do them at the end, or she'll answer herself in the chat. So feel free to do that. Thanks again for joining. And it would not be without the wonderful support of the Florida Department of Health that we are able to talk to you today about Count the Kicks. It is with their support that you can get all this material for free. You can get these webinars for free. We can come talk to your internal team for free. We are so glad and happy for this partnership with Florida Department of Health to bring Count the Kicks to save more babies in your state from preventable stillbirth. And so with that, I am just going to turn my video off for a little bit because I have a lot of videos to share and it helps with my broadband Wi-Fi. And so your presenters today are, I'm so excited, Casey Omeki will be here. She is going to say a couple words. She's from the Florida Department of Health. Her contact information is on the screen. So if you have any other questions about Count the Kicks or this partnership or anything, you can absolutely direct them to Casey. And then we have Stephanie Moody. She is our Health Equity Coordinator. It's a brand new position with Count the Kicks, and we're so excited that she's on board. Her contact information is there as well, and she will also be helping with the chat and the answering of the questions. And then of course myself, I'm the program director with Healthy Birthday Inc. My contact information is there. I've been with the organization for almost 2 years. Prior to that, I actually worked for the state of Iowa Health Department. So very familiar with health department, public health in general, really passionate about systems change and prevention. And so you'll hear me talk a lot about how you can really integrate this into your system, whatever protocol or system that is. I'm here to help you feel comfortable talking about stillbirth and stillbirth prevention, and then to implement this into your practice to save more babies. And so I would love for Casey to do a welcome. Go ahead, Casey.
Thank you, Megan. Good morning, everyone. My name is Casey Omeki. I'm the Florida Department of Health Human Services Program Consultant in the Maternal and Child Health Program. And I currently work very closely with Megan to implement Count the Kicks in the state of Florida. I'm very excited to be here this morning with Megan to share this amazing opportunity to learn about Count the Kicks and how it can be shared with expectant parents. So I hope everybody can gain a little bit of knowledge from this, this brief presentation. And if you do have any questions, you can certainly call me or email me. I see my email is right there, so feel free to reach out anytime if you have any questions or concerns. So thank you, Megan.
Awesome, thanks, Casey. And so one of the things I like to do first with the presentation is do a video to kind of set the stage. This is a video that aired on Good Morning America in 2017. It is about baby Ruby, who was saved in 2017 when her mom noticed reduced fetal movement. And I like to show this video for a couple of reasons. One, it does a really good job of just giving you right away an idea of what the Count the Kicks app and the campaign is all about. Two, one of the reasons, when this aired on Good Morning America, we saw a huge increase in app downloads, like 3,700%. And so we are pretty high since then, but it really goes to tell you that storytelling and that mom to mom, that media, that communication is huge. So whenever we hear about a baby save or anything like that, we are always in the media about that. And so we were fortunate that Good Morning America picked this up. And I think it's just third, I like to show it because it's a really good feel-good story. The founders wanted this campaign to be empowering. And so even though we're talking about stillbirth today and stillbirth prevention, and I just want you to know that we do have those babies saved, and we do have those happy endings too. And so I'm going to start out with this video.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Yeah, so like I said, I just like playing that. I hope it kind of set the stage for what the app is and what it can do and why we do it, you know, understanding baby's normal movement pattern. And so before we get too much further into more details about the app and how to implement this, I do want to talk about the definitions and facts, just so we're all on the same page. I know the majority of you are midwives and doulas and OBGYNs, and so this isn't, this should be common knowledge for you, but just so we're on the same page, stillbirth is a loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. You can see those definitions there. Miscarriage is usually defined as loss of the baby before the 20th week of pregnancy. And then infant mortality is death of an infant before his or her first birthday. A lot of times when I'm talking to people, they tend to merge like stillbirth and infant mortality together or get confused by the two. So I really like to separate that out to show you that we are losing just as many babies to stillbirth, in fact, slightly higher than we are to infant mortality. This isn't to underscore anything about infant mortality or, you know, the wonderful campaign for Back to Sleep and SIDS prevention and things like that. What I want to do today is I want to get to a point where we're having a conversation about stillbirth prevention, just like we're having conversations about lay your baby on their back, don't smoke, you know, don't smoke around baby, put a fan on, you know, no blankets or anything in the bed. And so I really like to point this out because I think this surprises people because we don't talk about it. We don't talk about stillbirth, and we need to change that narrative. And that's why you're here today, so that you become comfortable talking about this and that you can help change that narrative by talking about this with your patients. Again, some of the causes of stillbirth, we won't go into detail about this because today we're focusing all on prevention, right? But if you're interested, here's where I pulled this information. There's lots of research on this, but some of the common causes in, you know, pregnancy and labor complications, problems with the placenta, birth defects, infection, umbilical cord, and then medical complications in the mother. So you can look at that link for more information if you are interested in more of the causes of stillbirth. And so briefly, we want to talk about data. 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times in some states, more likely to experience a stillbirth over their white friend, neighbor, or colleague. Unacceptable. Hispanic, Latinx moms, 1 in 199. Indigenous women, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. And again, it's just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. So when we look at the Florida data, and you can get this all on that website there, the 2019 stillbirth rate for Florida is 6.8 deaths per 1,000 deliveries. That's 1,515 fetal deaths in 2019. And then you can see it's broken down by race. So white is 5.2, Hispanic women is 5.7. And again, there is that high disparities. Black women 11.5 and non-Hispanic Black 11. And so we really want to work to bring this campaign where we've seen a 32% reduction in stillbirth rates in Iowa. We want to bring that 32% reduction to you all in Florida. And so we have some preliminary 2020 data. Stillbirth rates, fetal death data tends to be about a year to a year and a half behind, depending on the state. Florida is fantastic with their data and their website. So you can get a lot of information from that. They're probably one of the best states that have such detailed data and recent data. So I always like to do a shout out for that because I love that website. But in Iowa, we do have some preliminary data for 2020. And it is, our stillbirth rate is 4.0 fetal deaths per 1,000. So it is the second lowest Iowa stillbirth rate on record after 2018 and one of the lowest in the United States. We were, if you see that little blue dot that's highest in 2008, that is when Count the Kicks was created. And so that was our highest stillbirth rate. And you can see we have been in a downward trend since 2008. In those first 10 years, 2008 to 2018, there was a 32% reduction. In the first 5 years, we saw about a 39% reduction among African-American Black women and their stillbirth rate. And so public health officials have said here that there really wasn't anything else being done that would have made such a significant impact on the stillbirth rate. It's not like every pregnant woman got a doula, which would be amazing, and that would significantly decrease. It's not like smoking among pregnancy dropped dramatically. In fact, that's gone up, as well as obesity, all those risk factors. And so they have said this has been the only public health campaign that probably made such an impact on this stillbirth rate. And so I just want to show this because this is what we want to bring to Florida, right? Like, this is why we're so happy about this partnership with Florida Department of Health, and you're here today to learn about it and to do more to save babies. And so you might be thinking, why are there such large disparities for stillbirth? And so there's a lot of different contributing factors to racial health disparities in stillbirth. I don't think this will come as a surprise to anyone, but I think it's very important and something to always think about as you're treating women and working with women of color and things like that. So researchers point to the following as causes for disparities: systemic racism, toxic stress. Research shows that years and years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it, has led to real and pervasive health issues for Black women. Those epigenetics, those physiological variations that are caused by external or environmental factors, literally years and years and years of that toxic stress and systemic racism has changes in the DNA sequence. And predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. And so we know there are large gaps among racial disparities in stillbirth, and we have made it a priority to focus on this issue. We have done a variety of different things to really shine a light and hopefully decrease the number of stillbirths among these individuals. a couple things that we've done on the slide. You can see we've hired our health equity coordinator, Stephanie, who's here today. So we're so excited she's on board. We're always looking for funding opportunities to reduce racial disparities. One of the reasons Stephanie got included was we worked with her last year on a grant where we worked with primarily Black beauty salons and churches to educate and share about Count the Kicks so they could share within the community. And so she helped us with that project. And then improving programming based on lived experiences of women of color. We've done a couple of focus groups where, you know, we're just trying to figure out what are those barriers and what can we do to reduce those barriers, and then implementing those changes. For instance, that beauty salon project was created based on focus groups because we were told that, you know, they get their information from a lot of variety of different sources. It was their hairdresser or their mom or their grandma or their pastor. And so we changed some of our programming. The other thing that we learned from the focus group from the individuals that participated were they were all shocked. They had no idea that they were 2 times, sometimes 3 times more likely to experience a stillbirth. And they said, why? Why isn't anybody talking about this? Why are we not shouting this from the rooftops? Don't sugarcoat it, right? We are not delicate flowers. Tell us like it is. And so we, with the help of Stephanie, we created some pieces that did that. You know, we put it out there. You're 2 times more likely to experience a stillbirth and things like that. So really working within marginalized communities. We have their app in 12 languages, culturally appropriate and educational materials. We have videos and printed educational materials and FAQs in multiple languages. So we know there's still so much more to do. And so we have that laser focus on disparities and bringing all of this type of work to Florida as well. So research and evidence. So now that you know more about the data, let's talk about how this is truly an evidence research-backed campaign. So when the founders were all 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time. They got together just through grieving and pastors and friends. And long story short, they were at a conference where they heard this Dr. Ruth Fretz and some other researchers talk about a study, a public health study that had been done in Norway that showed a reduction of late stillbirth with the introduction of fetal movement information and guidelines. And so this study showed that when women among this cohort that were pregnant were educated on the importance of tracking fetal movement and understanding what's normal for their baby and when to speak up, decreased stillbirth rate around 30% among this cohort. And so the founders said, we can do this. We can bring a public health awareness educational campaign to Iowa to share about the importance of fetal movement monitoring. And that's exactly what they did. They came back and they got some funds from Iowa Department of Public Health and worked with the local marketing company and created Count the Kicks, the campaign that you know and see today. We did not invent kick counting. Of course, that's been around for a long, long time, right? What we did is we took research and studies and created the tools and educational materials so that you could feel comfortable talking about this with your expectant parents, and expectant parents would understand the importance of tracking fetal movement and why and how and when to speak up. And so Dr. Ruth Fretz, she's also on our medical advisory board. She was one of the researchers of this Norway study that really started it all. And this is one of my favorite quotes is from the study that says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. So you'll see me and hear me talk a lot about normal, like what baby's normal is, because everybody's normal is different. And we'll go into that in a little bit, but I want you to keep that in mind as we go through that. Some other maybe misconceptions or things that you have heard, you know, it will increase anxiety if we tell all moms to count kicks and then they're obsessed with it. They're just going to be anxious all the time. And so I've pulled a couple studies here. You can see they're all cited there. So it says one potential side effect of this one of routine monitoring could be an increase in prenatal visits, either outpatient or in hospital. However, Most research has not found this type of increase to be true. Usually fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And so we have done a couple studies of our own that we have some preliminary findings that you can see there. That's what I can share until we get the manuscript out. But a lot of our preliminary findings are also saying that, you know, women found this tool to be very positive. It helped them bond with baby, made them actually feel less anxious, and it really educates women on when to speak up. So they're not calling all the time with worries. You know, they know when to speak up because that's what the education does. As part of our app, we also have we call it a finished pregnancy survey. So after a due date has passed, we ask moms if baby's been delivered and just a couple questions of our own if they feel like answering. It's not required, but we ask about anxious, you know, did this make you feel anxious or less anxious? Did it help you bond with baby or not? And then what was your birth outcome? And we have analyzed a year's worth of data, and 78% of the women reported that the app made them feel less anxious. And more than half of the women indicated that using the app helped them bond with their baby. So another thought or some information or feedback I've received before is that this is just going to increase C-sections and other interventions. Here's another source, and we have all of this on our research page. If you're really into reading research and journal articles, you know, that's awesome. So this is one that I pulled, increased maternal awareness of fetal movements by Mind Fetalness. This is over in the UK area, that's what they're calling it. In the 3rd trimester is advantageous for mother and baby. Spontaneous start of labor increased and interventions, notably cesarean C-sections, decreased. Fewer babies were born small for gestational age and in need of neonatal care. Women have expressed having positive attitudes to the method and feelings of safety and calm. And we have not seen an increase in C-sections in the last over a decade here in Iowa. And then another one is additional benefits that I think some people don't realize or think about is, you know, reduction of preterm birth rate. Our executive director is a perfect example of this. At 30 weeks pregnant, she noticed she was having, you know, reduced fetal movement and contractions. Went to the doctor, found out baby wanted to be delivered a little early. They figured out what was going on and were able to stop those contractions. And she was able to carry baby healthy and fine to 40 weeks. Fetal growth restrictions identified earlier. When mom's aware with her body and what's going on with baby, she can speak up and know that there's something wrong and listen to that intuition. And then women who have had stillbirths are at higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. And so we have seen that stillbirth and maternal morbidity are intrinsically connected. There was a study in California that showed this too, where they analyzed hundreds of thousands of birth outcomes and fetal death and things like that. And what they found were when somebody had a fetal death, a stillbirth, they were 9 times more likely to have severe maternal morbidity and mortality. So really, due to the low cost and potential benefit, it's recommended, this is a citation as well, decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So that's all I'm going to talk about with the research. Like I said, we have a lot of other research articles on our page just on our Count the Kicks website to look at if that's something that you're really interested in. But I want to keep moving through like the implementation. I wanted to share this video. So when I talked about when the founders came back from that conference and they knew this is what they wanted to do, they wanted to honor their 5 daughters that they had lost to stillbirth and infant death, and said they went to Iowa Department of Public Health for some funds for this. And so Kimberly Noble Piper, who you'll see here in a minute, she works for IDPH and has been there for years, and she has been with the founders since the beginning. She is a wonderful woman, always a big supporter. She's also, she was a previous labor and delivery nurse, so she has seen firsthand how stillbirth has effects, not just, you know, the family, but the medical providers, the staff, everyone involved. And so because she's been with us for so long, she's also the Iowa Department of Public Health project director for the Iowa Stillbirth Surveillance and Prevention Programs. I wanted to share this video of her and her experiences.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So I think she, especially as medical providers on here today, and doulas and midwives, and anyone in that field who has experienced that with a patient, I think you could really resonate with Kimberly. And so this is a long quote of hers, but I kind of bolded the last section because it says, research shows that babies can be saved if expectant parents are educated about tracking their baby's movements and immediately reporting any changes in the baby's movement pattern to their healthcare provider. And so with that, it's a really good segue into what you're all here today. How do you implement this? What is it, and how do you do this? And so I was so happy a lot of you filled out those questions when you registered. It sounds like a lot of you do know about Count the Kicks, and a lot of you are talking about fetal movement monitoring. And so my goal today is to just make you even feel more comfortable about it, and to get you to really implement it into your protocol so you're talking about it at every single appointment in the 3rd trimester. And so again, Count the Kicks is a stillbirth prevention public health campaign. It's evidence focused, it's mom focused, it's empowering. It educates women on the importance of tracking fetal movement. We have our mobile app, which we'll talk about on the next slide, but we also have paper charts available in Spanish, English, and Haitian Creole, in case you have somebody that doesn't have a smart device or has Wi-Fi or broadband issues. And most importantly, one of my favorite things about the campaign, it's empowering. It empowers moms to speak up to providers if there is a concern. And so I've talked a lot about the app. If you haven't downloaded the app, I want you to take a minute. I'm going to keep talking, but I want you to actually go into your app store, whether it's the Google Play Store or the Apple Store, and download, search for Count the Kicks. Find it'll be the little yellow icon with the clock, and download it while I'm talking. And the reason I want you to do that is because I want you to go through the app. I want you to use it if you're not already, because I want you to know how easy and user-friendly this is. So you can go to your patients and clients and say, look how easy this is. Let's go through it together. And so our free app is available in 12 languages: Amharic, Arabic, Chinese, English, French, Haitian Creole, Hindi, Marshallese, Russian, Spanish, Swahili, and Vietnamese. Haitian Creole is a new addition from last year. Again, thanks to the awesome support and partnership with Florida Department of Health, and some other coalitions and outreach there. They said, this is great. We need this in Haitian Creole. We need this, and we need the materials in Haitian Creole. And we said, absolutely. Like, your demographic and population the best. And so that's why it's in Haitian Creole now. So that hats off to Florida Department of Health. It's available for Apple and Android products. Users can restart their session or delete a kick session. One of the most important features, I think, is really setting that daily reminder to count kicks. And you want to educate your parents and your patients. We're all busy, even in a pandemic. I feel like I'm busier than ever because I have some kids on the bus and some kids home online. It's just crazy. And so setting that reminder so they never forget to count is just key. And they can do that all within the app, and it will notify them when it's time to kick, because we want expectant parents to count daily, preferably around the same time each day. They can review that kick counting history. They can download and they can send it or text it to friends and family, or if they have like a My Chart, they can upload it into their My Chart to share it with their provider. If they want, they can bring it to their next appointment. They can print it out. Right now you download it and it's through your email. We're updating that so people can download it right away and save it to like a file on their phone versus their email. But they'll still have the option to email it and things like that. You can count for singles or twins on the app. You can track future pregnancies, so you don't have to create an account for every single baby. I've had 3 children. The last 2 I could have tracked with. I did the last part she was born in 2015, right when the app came out. And then 2018 was my son. And so I didn't have to create a different pregnancy. And then I could see some of her data towards the end of her pregnancy, right? So that was really neat. You can manage multiple devices. So we can have significant others use the same account and see the same information that mom is when she's counting. So it's really about that bonding experience with the entire family could happen. And soon, this says next year, but this is going to be in a couple months, available on Apple smartwatches very, very soon. And so we're super, super excited about that. And so now that you've hopefully taken a break and been listening to me and multitasking, but downloading the app, I want you to mess around with it. You can count for singles or twins. It's really about seeing what's normal for their baby, because we know every baby and every pregnancy is different. Be sure you share with your patient or client, if you're their provider, how they can contact you if they notice a change, especially because, if mom is, late and counts like at midnight or 1 o'clock, because that's just when she's up or something like that. It's okay for her to call. Who should she call at that time? We want moms to know that, as well as during the day, and so what is a change? The app starts showing the average time it takes to get to 10 kicks right away. So users will really start to visually see that pattern or trend form with their baby after a couple sessions. So then if mom starts noticing maybe it's taking closer to an hour when it usually takes 15 minutes, she should call her provider, just like baby Ruby. You heard her mom say, I usually got 10 movements in 10 minutes or less. And this time it was taking close to an hour and it just wasn't getting there. And her movements felt different. That's a change. And so that's what I really want you to stress to parents, is that it's what's normal for them and that baby. They cannot compare it to their friend. They can't compare it to a previous pregnancy. Like I said, I've had 3 babies, and my first and my last, I would always get 10 movements in, like Ruby, 10 minutes or less. But my daughter, the middle child, she took around 30 minutes. And that was long, right? That was long for me, that not, if I was comparing to the other one. So I remember calling, I'd go in, they'd check me out, and, I realized that was just her normal, right? That her normal was 30 minutes or less. And she would get the 10 movements whenever I sat down to count. I had to do that with her. And so just understanding that it's different for every baby and every pregnancy. So I have this video. There's no words. It's just going to be me talking about the app as it goes through. So I've recorded myself doing it. So there's a couple features I want to point out. First, there's this how it works. And you're going to see me click on that here in a minute as I'm counting. But if you just downloaded the app for the first time and signed in, you'll see this how it works. It's like a carousel, basically. In order to even access to start counting, you have to go through this like how to button. Users can access that at any time. So let's say they're like, oh gosh, what was I supposed to do? Or I just need a reminder. They can click on that, and I'm going to show you that. And then right away, there's this big red button, start counting. Pretty easy, pretty straightforward. And so I'm going to just hit the start counting button. You see the big footprint. I feel baby move, so I tap the footprint and the timer starts. So every time I feel a baby move, I'm going to hit the footprint again. Same with mom. We know those are jabs, things like that. And so you can see right there, I took a second and I clicked that how it works. So I'm going through that carousel again, that introduction of how to do this. You can access this at any time, and the timer should pick up where I just left off. So maybe I'm reading this while baby hasn't moved yet or something like that. And so we'll go back out, and there we are. I'm going to finish the sessions, probably go out so I can show, because you can go out of the app to look at something and come back in and continue a kick session. We added this feature not too long ago because we were getting told like, oh, I just had to take my baby or my toddler to the potty or something like that. And now, did all this counting for me and I wasn't ready and stuff like that. So I wouldn't suggest doing this if like they put their phone down and they come back to it 2 hours later because they got sidetracked. They should just start a new session then. But it is really helpful if like, you know, toddler has to go potty, and we all know how much potty training is not fun. So doing that and, or, you know, grabbing something from the door or something like that is totally fine. And so I'm counting again, I'm counting fast so you can see the graph. So you can see right away, we're starting to see very visual. You have the total time has been 6 seconds. My average time is 34 seconds, what the dates are and the last 2 sessions. So once users are signed in, they will actually see their last 5 to 7 sessions. If they're not registered and signed in, they'll only see about 3 sessions. And so that's an incentive to register. Plus it saves the data. So then you can click finish session. Here I'm emailing the data, or you can view the sessions. I'm going to skip. This is the FAQ. Here I am counting in Spanish. Same exact process. You can see my graph has changed a little bit. I think I'm going to go back and change to English on the menu side. Yep, going back to English. It's asking me to reload. And then I can start counting. I can do baby safe stories. I can read those. I can share my own story if I have one. I can count. So here I'm doing it again. Here's twins. I'm going to show you twins here. So for twins, it's the exact same method. You just, you know, you can name your babies. I'm doing that. Oops, did I miss a session? Okay. So I want to show you, I'm counting for babies, twins now. You can see all the different features that you can do. You can edit it again. Maybe you need to change your due date or something like that. Okay, so when you're counting for twins, you can do it a couple ways. I've never had twins myself, but I've heard from a couple twin moms who have said you can do it like I am right here, where I'm flipping between the 2 babies whenever I feel a movement. For Georgia baby 2, it's teal, you can see. So now I went back to baby 1 and it's teal again. That means I'm counting for that baby. So you can go back and forth, or you can just do one at a time, right? Like you can just, because the timer starts. So you could do that, whatever mom is most comfortable with. Research shows that you can count for twins. It tends to be maybe slightly more difficult to feel all those limbs, but moms usually have a general good sense of where each baby is. When we start getting triplets and quadruplets and things like that, that gets a little too much. And so that's why research says only twins and singles for that. So I just wanted to briefly run through that. Like I said, I really want you to go through it as well, have that kick session. You can see this average, this is kind of what it looks like for what I would say, this baby's normal, obviously, is 15 minutes. You can see the graph is pretty linear. You can tell each session has taken around 15 minutes, sometimes 17 minutes, but it's not like you see a huge spike or anything like that in the graph. And so this is a good session. This shows mom that her baby's normal is 15 minutes. So let's say she's counting one day and all of a sudden it's taking an hour to an hour and a half. She knows that that's not her baby's normal and that she should call her provider and then leave it up to you and the provider to say, okay, we're going to come in and do, you know, talk you through whatever test you want to do, whether it's an NST and things like that. We also have those paper charts available on our website as well. I wanted to show you a couple new features that we're super excited about that will be launching soon. I want to really preface though and say you guys are the first to hear this, so that's really exciting. But the reason you're the first is because this has not launched yet, but it will be launching soon. And since I knew I was having this presentation and talking to you all, I really wanted to make sure you knew and understand this new feature that will be added, because when it's added, we won't have this webinar. We'll have another one later in the year, but I really wanted to show this. So again, this is not on the app yet, but it will be coming out with a new release within the next month or less, maybe a couple weeks. If you think back to that baby Ruby story, when you heard the mom say, I noticed her movements felt weaker. Research shows that moms should also be paying attention to the strength of their baby's movements. At the end of each kick session, now what we have added is a way for moms to kind of track how their baby's movements have been via strength. So it's after each kick session. It's not after each kick. So you can see, I put some screenshots up of what it will look like. So we have the strength tracking, like the how-to basically. We say if your baby's movements become weaker, it can be a sign that your baby needs to be evaluated. Contact your doctor if you notice your baby's movements become weaker, and then how to track. So that 1 foot, those are those fluttery movements. These movements are light, hard to see from the outside. It may feel similar, if you've had a baby before, those tickles, butterfly wings type thing, gas bubbles, some people say. Level fine, fierce. These movements are very strong. From the outside, it may look like a limb is trying to poke out. And then we really just want them to judge the strength of your baby's movements each day. And then just track that. And so you can see on the second screen, mom can put in however strong she felt baby's movements are. And so it doesn't matter if mom's always a 2 or mom's always a 3 or mom's always a 4. What's important is that that strength doesn't change dramatically from session to session, right? And then they can also have notes. This has been a huge ask from our users. I wish I had notes. I wish I could put in notes to say, I was gardening all day and, or something like that, just so they could remember, and then they could talk to their provider about it too. And so once they click finalize session, you can see the graph at the top, but then I've also done, they're going to see average movement strength. So the average movement strength for this baby is 4 colored feet, basically. So I would know if I was counting, and that average changed over time because you can see the bars at the bottom are showing. So you can see on May 6th, my strength was a little bit weaker, but then it went back up to normal and stuff like that. If my movement was normal, I probably would have felt fine with that, and things like that. So it's just an additional ways for moms to be aware of them, of their baby. This function, like I said, will be coming out soon, and I wanted to make sure to address it so you could talk to your patients about it because it is such a new feature and newer concept to a lot of people. I think it's really important that we educate on it and make sure our moms know why they're doing this. And that story, you can share that Good Morning America story. I mean, that we have a lot of those baby safe stories you can share. So feel free to ask questions. Another app feature, like I said, is our mobile app. This will be on iPhone, watches, iWatches, Apple Watches, whatever. Apple Watches first, and it's very straightforward. You can just count. So if mom's upstairs lying in bed and her phone's all the way downstairs, she can start a kick session and do it on her watch, and all the data will sync. So we're super excited about this feature as well. So you can share that with your moms, and we'll be sharing and communicating this all out. So definitely sign up for like our newsletter and things like that. And I know we will have more webinars to go into more detail, but I really wanted to do that. So we're getting close on time. I told you I had a lot to cover, but how do you implement this? So talking about stillbirth with expectant women, we know and understand stillbirth is something nobody wants to think about or talk about, but it is so important. You might be thinking, I don't want to scare moms. Pregnancy is full of risks. You know this, I know this. We talk to moms about all of these risks, and stillbirth is another risk that moms deserve to be educated about. Stillbirth just happens. There's nothing we can do. There can be warning signs if mom knows what to look for. Reduced fetal movement is a warning sign. Her baby's always active. You might hear this more from like when you're talking about count the kicks to a mom saying, I don't need to do that. My baby's always active. Babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. She's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. Some other misconceptions, babies move less closer to their due date. Again, they don't move less, they might move differently. You may feel less sharp kicking and more of those rolling. However, if you're monitoring baby's movements at the same time or around the same time, it should still take about the same amount of time to feel 10 movements. Here's that active one again. Tracking your baby's movements takes the guesswork out of knowing if your normally active baby has slowed down. Here's a really big one, especially in a pandemic where telehealth appointments and prenatal appointments are getting stretched out. I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement. A change of baby's heartbeat is one of the last things to occur when a baby's in distress, whereas decreased movement is an early sign. And so I know there's apps you can download, so unless they're medically trained, we really do not recommend using a Doppler. The other thing to think about is when you and I are sick or our kids are sick, we just want to lie around, right? We just want to lie on the couch and watch TV. It's the same thing for babies in utero. They're not feeling good. Something's going on to make them not feel good. So they're conserving that energy and not moving as much. Babies just getting ready for birth and running out of room. If you work with patients that have multi-generational households, this might be a common one. Babies should continue to move up to and during birth. We know that. Mom should get 10 kicks in 2 hours, that old adage, 10 and 2, 10 and 2. Again, this is common misconception and outdated. What research now states is that mom should be focusing on fetal movements in general and understanding their baby's pattern. Again, we have a research study on this on our website that you can read, but basically what it's saying is when you put that time limit on them, right, that's what we focus on. That's just our nature. So let's say I'm counting and normally my baby takes 15 minutes and one day I count and I get baby's movements in 1 hour and 47 minutes. And I think to myself, well, I still got it within 2 hours, so I'm set. But that's a significant change, right? Like, and so we want to go back to what's normal for baby, what is normal for baby and that pregnancy. And then only high risk expectant women should do this. All women should do this. We don't just do the glucose test for high-risk women. A lot of women, a lot of our ambassadors who have had stillbirths had absolutely no other risk factors. In fact, a lot of them have had previous live births and had no idea that they should have been counting movements. You'll hear that story time and time again from our ambassadors. And so we want everybody to be doing this. So you should be doing this around 26 weeks if they're high risk, or 28 weeks otherwise. If you are somebody that does childbirth ed classes or anything like that, we have a lesson plan you can use. But otherwise, it's very simple. You know, ask questions. Do you know about the importance of tracking your baby's movements? Let's talk about how to track your baby's movements and share how movements are jabs, rolls, pushes, anything but hiccups. And then sharing the Count the Kicks app. Helpful tip. I love this one. In Iowa, anyways, we have to go do our glucose test and we have to drink it in front of a nurse. She takes our blood, or before, I can't remember exactly, but then we sit down for like an hour and wait in the waiting room. Even now, they're doing it like that. That's a perfect time to say, hey, while you wait, download this app, read this brochure, and when we come back for your appointment, let's talk about it. The 15-minute appointment after that. So that's just a simple thing that you could do. Again, stress the importance of knowing their baby's normal and speaking up. Make sure they know who to call, what number to call. If you have an after hours line, a nurse line, make sure they know who to call. And that goes for anything, right? Whether it's reduced fetal movement, bleeding, contractions, they need to know who to call. Send the brochure home. Again, we'll talk about that, but with this partnership with Florida Department of Health, you have access to all of our free educational material. And so we'll talk about that in a minute. Share that mom that research shows evening is usually the best time to count baby's movements. However, I don't want you to get too hung up on that. I don't want mom to get too hung up on that. Just really picking a time around the same time every day is really important. Tell mom, if you're not her provider, that her provider should be asking about this at every single appointment in the third trimester, and not something like, you know, I remember when I was 20 weeks pregnant, a nurse had asked me, have you felt baby move yet? And that was the last time somebody talked to me about fetal movement. The only reason I knew about Count the Kicks was because they had a poster on the wall. So really engaging with your patient, saying, tell me about your baby's movements. How is tracking your baby's movements going? And can you show me your Count the Kicks graph? If you are not their provider, you know, you can still do this and engage. We, you know, you usually like to talk about our pregnancies, right? And so just engaging in them. What questions do you have? Open-ended, think back to your motivational interviewing type skills. And then if you're not her provider, encourage mom to tell her provider about Count the Kicks. Again, it's all about that empowerment, right? So how do you talk to moms who have had a stillbirth previously about fetal movement? It's the exact same protocol. And we have reached out to all of our ambassadors that have had stillbirths and then subsequent live births. And this is the feedback they gave us of what they either like to experience or wish they would have experienced with their next baby. So since women who have had a stillbirth are more likely to experience another stillbirth, we want to start talking about this and have them track at 26 weeks. Feel free to talk about the previous stillbirth and acknowledge her child. especially if you were not her previous doctor. You know, what was baby's name, gender, just, you know, stay away from those medical terms like fetal demise, be empathetic. I mean, this is just, you know, how you would probably normally do it. It's just more important to talk about because they're at an increased risk. So ask if anyone has talked about the importance of fetal movement tracking. A lot of moms that we've talked to have said, even though they've had live births, nobody stated that they were, you know, the importance of tracking fetal movement, and they wish they would have known. They wish, you know, why didn't somebody tell me about this? And so we want to turn that why into, I'm so glad somebody told me about this. And that's why you're here today. And that's why this is so important. And then you can implement this into different settings, whether you're here today representing an OB clinic, midwives, home visitors, FEMUR, childbirth educators. It's all pretty much the same. You become familiar with the app and the materials. You order for free on our website. You fill your shopping cart, put in your waiting rooms, in your restrooms, in your patient rooms, in your ultrasound tech rooms. Like, any touch point is great with mom. If you want to review our sample course material, it's on our website. If you want to integrate some of that into your current practice, make sure everybody knows about this. Like I said, we can do an additional webinar for you and your team if you'd like. You can send this recording to them afterwards. And then, like I said before, I'm really, really passionate about integrating and touch points and documents. So I'll talk about that here in just a minute, of some ideas that you can easily do. So again, stress to parents to trust their instinct. If mom feels concerned or that something isn't right, call her doctor. Share that sleeping lying on their left side is best for them and baby, and then review those common myths and misconceptions. Next steps, I want you to, of course, download the app. I want you to play around with it and practice. I want you to share this information with your entire staff. I want you to order material. Again, here's Casey's contact information if you have additional questions. Some other ways to integrate: use a form at check-in, which I'll show you in a minute, that we've created. We're piloting it here in Iowa. Have all front desk staff trained and ask patients to fill out this form. And so we have created this form. Basically, when you come in, and we usually have a wait time, even if you're waiting in your car and you get called in to come in, you still have to check in, right? You still usually have to go, or the nurse can hand this to them, right? Have the nurse or the front desk person hand this to them while they're waiting for doctor, fill this out in the waiting room or in their patient room. Then they'll hand it back to the nurse or hand it to the doctor when they come in. The right-hand side on the screen that you see has perforated edge, so they can take that side home and fill that out. And so then the provider's office keeps the left-hand side. And this can be done for home visitors or WIC. This can be done anywhere. And so again, that glucose test is good. If you are interested, we have some agencies interested in adding a question to their EMR, EHR records. This should be super simple to add. There should be a pop-up that says, you know, it's automatically, you know what they're there for. They're there for their 30th appointment or 32nd week appointment or something like that. It should pop up to remind a provider, nurse to talk about fetal movement, just like it pops up going over the medication and stuff like that. I would love to do that and integrate. So let me know if you're interested in doing something like that. Here's an example of Celebrate One. They are a nonprofit in Ohio, and they work with over 2,000 pregnant women in the Columbus area. And they're similar to like, they're a community-based organization where they have all these different resources. But when they work with women, they ask all of these questions, and they added the question about, have you started prenatal care? And then, have you downloaded the app? Yes or no? And that's really just a trigger for the like home visitor or the staff to say, okay, let's move, you know, they said no, we're going to go in and talk about Count the Kicks now, or they said yes, here's my script, that type of thing. Super simple, easy to add. I can help you with the language if you want something like this. It's something that we can easily do. We also have these awesome how-to videos. If you have like a rolling video in your waiting room or something like this, you can use these. You can get these all on our website. You can get them on our YouTube channel. These are really great to share in like childbirth ed classes, or as you're having mom wait in her room, you could share this with her. hopefully going to be adding a video function to the app so you can pull it up right there on their phone and show them. Again, awesome, shout out to Florida Department of Health. We have this video in English and Spanish. It's super short, so I'm going to play it for you in English.
Count the Kicks is a great way to monitor your baby's well-being, which is why many doctors recommend making this part of your daily routine at 28 weeks or 26 weeks if you're high risk. It's easy to do using our free Count the Kicks app. Just pick a time when your baby is active, preferably the same time every day. Sit with your feet up or lie on your side. Count each movement as one kick by tapping the footprint on the screen, and the app will show you how long it takes to reach 10. You'll soon get to know what's normal for your baby. If you notice a change in the strength of your baby's movements or how long it takes to get to 10, contact your healthcare provider right away. The Count the Kicks app is free and available in 12 languages. Our app makes it easy to track and save each day's kick counting session. You can even email or text your sessions to your provider or family. Don't delay. Visit the App Store to download Count the Kicks today. And remember, every kick counts.
So like I said, we have that in Spanish as well, and you can show it from our YouTube. If you want to post it on like your website or anything like that, let me know and we can go through that together. And so this is baby Eva. She was saved in Kansas last year. She's 6 months old in this picture, and she's just so stinking cute. I always love sharing baby Eva. So resources, this is available to you guys for free. So we have promo posters in English, Spanish, Haitian Creole. We have how-to posters in English, Spanish, and Haitian Creole, app reminder cards, brochures, all in those languages. So one of my favorite things to do after, what I like to see after these webinars is we get these emails when somebody's placed an order. And so I see just my inbox full, right? Or our inbox full saying this, because you can just go to counttthekicks.org, click on order materials and click on your state. So I hope you take advantage of the free materials and start using it, placing it in your practice and everything, because it's completely free. And now, even more exciting is we have the literacy brochures and posters in English, Spanish, or Haitian Creole. Again, just add to your cart, and this is free thanks to a partnership with Florida Department of Health. A lot of times people will use these pieces if you work with, refugees a lot, or individuals who English is their second language, or they'll use it in conjunction with the other brochure. So use it as you see fit. It is another great tool in your toolbox to share and talk about this. And then we also have a CE training. Well, this was not a CE training today, but you can have access to one, and you can get it for free using the code SAVEBABIES-FL for Florida. I will send this out to everybody that registered as well. So you'll get a big email from me with all these resources and links and tools like this. So you can use this link and this code to access the training for free. It's 90 minutes. It's very similar to what we went into today, but more of just that big picture overview versus this is a little bit more, we talk about Florida data. We talk a little bit more of how you can integrate this and things like that. And then some additional resources. We have these academies. We have a provider academy. We have a parent academy that you could share with parents. It has all the tools and resources you might need to just send them a link or things like that. Those kick counting charts we have, coming soon, but really that's today. We have state-specific websites now. So you can see the left-hand images are, it's a website designed specifically for Florida. It talks through all of the materials that have been ordered monthly, all the app downloads monthly. It has videos, how to download materials and things like that. So this is created for you all to access. It's a specific link, and I'll send that as well. And then Florida Department of Health has created a link to have an overview of Count the Kicks as well. So you can see that link there. And again, I'll send this all out. But these are there's so much out there for you to use and that you can take advantage of. So really quickly, wrapping it up, a Count the Kicks ambassador, we have, I think we have 42 now across the United States. These women are volunteers who are passionate advocates due to their personal experiences. A lot of them are lost moms who found us after the fact, or they saved their baby. And they can really help with a variety of things. You know, they can help with medical conferences because we're based in Florida. It is obviously very difficult, even, you know, more so now with the pandemic, but hopefully that'll get easier. It's hard for us to travel. So if you really want that in-person meeting or training or anything like that, we train our ambassadors and work with them really closely. They're wonderful, wonderful women. They're our boots on the ground. They're our grassroots, and we couldn't do it without them. Your Florida ambassador is Sarah Sirianni. She lives in Bradenton, Florida. And you can read her story on our website, but she saved her baby after noticing reduced fetal movement as well. And so some other baby saves that we have, Nala, there's baby Eva when she was a newborn, Everett Luna. Fun fact, Luna is Stephanie's granddaughter. And Stephanie contacted, when she found out about Count the Kicks, she shared Count the Kicks with her daughter-in-law who was pregnant at the time. And that's when her daughter-in-law noticed reduced fetal movement and things like that and went in and saved baby Luna. So Stephanie on the call today saved her granddaughter. So Luna's there. The reason I want to point this out is because these baby save stories are so important to that mom-to-mom storytelling. We know from focus groups, from talking to moms, from community conversations that this is what gets moms to really truly utilize the app. Not is it just the provider, which is huge and important, but it's these stories, right? And I love Eva's mom's Yelly quote, her whole quote, but the one I like at the end where she says, you know, I highly recommend the app to all expecting moms. Happy and healthy deliveries to everybody. I just love her. And this is baby Deo. He was saved in 2018 by Nancy Travis, who knew about Count the Kicks. She came to an AWON conference. That's a neonatal nurses conference, and picked up a brochure, brought it back. This is way before we partnered with the state. Brought it back and started implementing it into her hospital system. And this woman noticed reduced fetal movement and saved baby Deo. And so we actually will be at the AWON conference, national conference in Florida this October, presenting, and we're hoping baby Deo, who's now 3, who just had another baby brother, I believe, I hope he makes an appearance at our conference is our goal. So we'll see if we can get them there. But yeah, those baby safe stories are huge. Connect with us. You can share our stuff. Sign up for that newsletter so you get all that information. And with that, I think we're right at an hour. I'm happy to stay on and take questions, or if you have any now. Otherwise, you have our contact information, which I'll go back to that screen so you can write it down. But yeah, I'm happy to take any questions if you have any. Turn my video back on. Let's go back to that screen. Otherwise, thank you, and I hope you order materials and download the app. So like I said, I'll be on for a couple minutes. You have to use the chat box. You're automatically muted. So if you do have questions, or the Q&A. But otherwise, enjoy your sunny Florida weather, because it looks like all of you are in the 70s or 80s. So, oh, thanks, Maggie. Thank you, thank you. Thanks, Casey.